Thank you, Sue. And I liked the opening when Dr. Francois asked you all to indicate your years of experience. It was great to see everybody stand up, but I'd like to ask all of the public health nurses in the room. I didn't get a sense of the total, so I'd like to ask all of the public health nurses in the room to please stand. So, thank you. Thank you. This is the day to salute all public health nurses in Georgia. And I do like the fun stuff, Sue. I like giving awards. But before I get to that, I do want to make just a few other comments. This has been a great day for me. I don't know about you. Have you enjoyed the inspiration? Because I've felt inspired at times, tired maybe when I listen to all these ideas, but not expired. I am the 30 years plus. I have almost 39 years in public health, 3 states, and I love every bit of it, every day. I want to thank, I really think we owe a big round of applause to our partners in the room, our CDC partners and our academic partners and the supporters of this day. Would you please recognize them again? And I don't have an award for this, but if I did, I would give somebody called Sue Dietz the champion of champions for all the orchestration of today. Thank you. It was great to work with. There's a couple things that I'd like to just let you know how pleased I am about where we are in public health in Georgia today as far as our top leadership. You heard the commissioner this morning, and you heard our division director. Now, Dr. Francois is my number 15 division director in 20 years. So we all have had a lot of change in leadership, and our commissioner is the 3rd commissioner that we've had since we have moved from DHR to the Department of Community Health. But we want to keep both of them for as long as we can. And let me tell you, I'm getting all the mileage I can out of both of them for public health nursing. We've already had discussions with Dr. Francois about 3 things that I want you to know about that really came up in some of the discussions just now. We are having discussions about the salary and the salaries that are needed to be upped for all public health nurses. And in those discussions, we're looking at where can we find and have a pot of money dedicated just to salary increases. Because we know it's not going to come, it's not coming from the counties and the districts. And we're looking at areas such as indirect monies. We're having those conversations. Tomorrow we're having a meeting with Dr. Francois and other department leaders on implementing the career track that the public health nurse leaders in Georgia approved, worked on for almost 2 years, and approved last year, has been sitting there waiting for the moment to be implemented. And so we are having those discussions. Dr. Francois is very supportive of it. We've already had 1 meeting at a higher level. We're having another meeting Friday of this week. And also another area is the training needs that we have to have more of for public health nurses, making better uses of what we have, but also using more of the electronic resources for training. And we're having that discussion tomorrow. So when you have new leaders, you have to jump in and make the most of them while you have them, and so we are advocating for those issues to become realities. All right. Well, today we want to recognize some public health nurses throughout Georgia. I think if Florence were here today, or maybe she's looking down at us right now, I think she'd be very impressed and proud of the accomplishments that all of you represent. But we are going to recognize a few public health nurses today. And what we're going to do is Michelle McLeod, my deputy chief nurse, is going to help me with this. I'm going to call the names of all the nominees, And then what we'd like you to do is to come on down and receive your certificate. We want to recognize all of the nominees first, and then I will announce the winners. All right? And we'll start, and hopefully, I think everybody is here. There are a few people that were not able to, some of the nominees were not able to be here, so we will make sure that they receive their certificates. But we'll start with District 1-1, Rome. That's the Northwest District. Is Kathy Green in the room? Kathy Green? Kathy. Kathy she's got two titles, don't you, Kathy? You're the acting district nursing director? Are you? No? You're the county nurse manager. All right. She's just the county nurse manager for Northwest District. Congratulations for the nomination, Kathy. And if you'll go over to Michelle. And then next for District 3-2, that's Atlanta, Fulton County. Tisa Dupree Bright, are you here? All right. You can go up that side. Tisa is a public health nurse 3 in Fulton County. They use a different classification than the rest of the counties in Georgia. And also from the same district, Fulton County, Michelle Fields. Is Michelle here? Okay, she's not here. So we'll make sure that she receives her certificate. And how about Vicki Norris? I saw Vicki. Vicki Norris from Fulton County. Oh, great, Julia. Julia Cooper, the district nursing director, is going to receive the award for Michelle. Thank you. And now we'll go to District 3-4. That's East Metro Health District. And Julianne Schell. Julianne is the nurse manager for Newton County Health Department. All right. And now we'll go to District 4, which is the LaGrange Health District. Amy Fenn. Amy is the Child Health and Immunization Nursing Coordinator for her district. And also from District 4 is Sherry Farr. Sherry? Is Sherry here? Sherry's not here? Okay. So we'll make sure that she gets her certificate. She's the county nurse manager in that district. Also, Judith Herod. Is Judith here? Thank you. Come forward. Judith is a public health nurse specialist in Carole County Health Department. And then also there are 4 nurses from District 4 being recognized today. Deidre Slaughter. Is Deidre here? So we'll make sure that she gets her certificate as well. And now we'll move on to District 5-1, which is based in Dublin, the South Central Health District. Kelly Knight. I saw Kelly earlier. Come on down, Kelly. Kelly wears many hats also. You notice how many multiple hats these nurses are wearing. Kelly is the immunization, SHAP, and drug coordinator for her district. That's at least 3 for now. And then we'll go to District 6, which is the East Central Health District. Denise Scott. Is Denise here? I don't think she's here today, but she is we'll make sure that she gets her a certificate. She's the district STD coordinator and also lab consultant. All right, we'll go to District 7, which is based in Columbus. That's the West Central.